Good afternoon, learners. You are welcome to NSA 511 Maternal and Child Health 1. My name is Mrs. Ogudipe Huye. Together with me as an tutor is Mrs. Oyekale Har. The facilitator for this course is Dr. Mrs. Owa Makede, which we are going to meet on face-to-face facilitation during your exam period. Today, we are having an interactive class on family planning and the health of women and children. When we're talking about the family planning, we are talking about how to prevent the unwanted pregnancy and the spacing of the child in order for this child and the family to have a living existence. Learning outcomes. At the end of this class, the learner should be able to explain the key messages related to child spacing and maternal and child health. They should be able to describe the major principles of family planning. They should be able to describe the health benefits of family planning. They should know and understand the relationship between maternal and child mortality, the high risk factors of maternal age, the birth order, and the birth interval. And as well, they should be able to compare the pregnancy and childbirth mortality risk with contraceptives use risk. Introduction. Family planning includes all the decisions an individual or couple make, whether, when to have children, how many children to have, and how they are being spaced. Health teaching is necessary because some couples want counseling about how to avoid conception. Others need information on increasing fertility and the ability to conceive. And they still need counseling because contraception, most of the contraception has been failed. Key messages related to child spacing, maternal and child health. The first one is the voluntary family planning, which is one of the most important health measures a couple and a nation comprises to reduce maternal and infant mortality and morbidity rates. The prevention of unwanted pregnancies and spacing of births by at least 2 years has a profound effect on reducing maternal and child mortality. The third one is the risk of death from pregnancy and childbirth, which is far greater than the risk of death from contraceptive use. As I've earlier said, family planning are the decisions made by an individual or couples about whether and when to have children, how many children to have, and how are they being spaced. When we're talking about the family planning, which is related to the mother, is as well related to the child, and is as well related to the family at large. In order for this family to have a successful existence, for them to have a successful living, when they space the child, the older one will be able to have enough care before the arrival of another baby. And this will help the family to grow. It will create mutual understanding between the couples and as well the family and even the extended ones. There are 4 principles guiding this family planning. The first one is the voluntarism. The second one is the informed choice. The third one is the widest range of family planning methods which are possible. And the fourth one is the integration within a general maternal and child health services program. When we're talking about the voluntarism, is when a client has the right to make an unpressurized voluntary decision on the contraceptive method, which is assuming medically safe. Some will argue even further that if a precaution exists and the client is fully informed of the risk, the client choice must still be honored by the clinician or the family services provider. What am I trying to say here is that a client has the right to make an unpressurized voluntary decision as herself. This decision has to be for the client. It's not that is not a nurse, a doctor, or a health practitioner, or the family planners that will choose for the patients. It's the client that will choose the method after the comprehensive explanation of different methods available for the clients. And this will help the clients to know which one to choose, which one is best applicable to our own health condition, and which one is good for them in order to have a good living. The second one is the informed choice, which is the confidentiality. Confidential in the sense that the client has been informed, explained to different methods available. And this has to do with the dignity and the respect for this patient, because we need to respect their decision. The preservation of dignity has to be informed in their decision, regardless of their age, regardless of the religion, regardless of the social or marital, or even the economic status of the patients. The third one is the widest possible range of family planning methods. This has to be applicable to the alertness on the part of health professionals for clients at risk for STDs, sexually transmitted diseases, which has traditionally been part of family planning services. HIV and hepatitis must now be added as areas of special attention. In this regard, distribution of latex condoms should be a mainstay of all family planning programs, which is involved the husband, the mother-in-laws, community leaders in family planning programs, and as addition of quality care to family planning programs. It should be encouraged, but at the same time, it is not to be considered a condition for providing family planning services to a client who requests for them. The family planning providers must extend the principle of confidentiality to the point of not involving any of the relations, if that is what the client wishes. The fourth one is the integration within the general maternal and child health services program. It is the responsibility of healthcare workers to assume leadership in educating clients, community, and special interest groups about significant health and other non-contraceptive benefits of family planning. With their considerable influence, physicians or healthcare providers can become powerful advocates of family planning by 1. Providing comprehensive, integrated family planning or maternal and child health services. 2. By supporting private sector family planning initiatives, such as social marketing programs. The third one is the introducing maternal and child health through family planning programs in factories, plantations, and other work sites. Another one is working to remove legal, regulatory, and procedural barriers to the availability of all contraceptive methods. What are the health benefits of family planning? The first one is significant reduction in maternal mortality and morbidity rates. Globally, an estimated 500,000 women die each year from pregnancy and childbirth-related causes, including septic abortions. 90% of maternal mortality deaths occurred in Africa and South Asia. And unpublicized WHO studies estimate that most of the complications for pregnancy and childbirth are the first or second cause of all deaths occurring in women ages between 15 to 44 in most of the developing countries. The major direct causes from these complications are the hemorrhage, which are from the unsafe induced abortion, toxemia, obstructed labor, and puerperal infection. Multiple and closely spaced pregnancies lead to and worsen such conditions as anemia, maternal malnutrition, and low birth weight babies. Using an effective family planning method reduces maternal deaths by preventing high-risk pregnancies among women who are too young, those who are too old, those who are too ill to bear children safely and unsafely. Maternal deaths can be prevented if unwanted pregnancies are avoided and pregnancies are spaced at least 2 years. Reduction in infant mortality and morbidity rates can occur if there is integration of these maternal and child care services. Globally, an estimation of about 14.5 million infants and children under age 5 die every year, mainly either from respiratory diseases or diarrhea or malnutrition. And worldwide, studies have shown that spacing of births at least 2 years could prevent at least 20% to 30% of these infant deaths and significantly reduce the devastating morbidity effects suffered by these children. What are other complications derived from these maternal and child care services? The first one, another one is ovarian cancer, endometrial cancer, ovarian cysts, benign breast disease, excessive menstrual bleeding, which is associated with anemia, menstrual clamping, pain, and discomfort. Breastfeeding protects infants against diarrhea and other infectious diseases, as well as protecting mother from postpartum hemorrhage. All family planning methods help women with AIDS to avoid pregnancy and thus avoid bearing HIV-infected children, at least through the regular focused antenatal. When they attend the antenatal as expected, this has to be prevented because they will be able to take care of the child and the mother, and as well the child in itself. The maternal high-risk factors. In many developing countries, the high-risk factors, which are referred to as too young, too old, or too many, too close, are major culprits of maternal and infant mortality. The age too young or too old in developing worlds make the pregnancy and childbirth are the leading causes of death in women under the age of 18 years. Those that are not up to 18 years, these are the causes of death, is one of the causes of death. When the girl child is not up to 18 years old and she got pregnant, she won't know the right from the left. And if care is not taken, is one of the leading cause of death. Mother younger than 18 and older than 35 years are at greater risk of prenatal complications and pregnancy-related deaths. Which means that the older one at 35 years of age, and even the primate at 30 years, we used to call them elderly primate because of most of the prenatal complications that being arrived during the pregnancy, during the delivery, and even mostly after the birth. Sources suggest that if pregnancy could be averted in women under age 20 and over age 35, maternal mortality could be reduced by 8 to 40%, and at most about 60%. And in Nigeria, the maternal mortality ratio is estimated to be 1 in 100,000 live births. The infant mortality rate is estimated to be about 1 in 1,000 live births. And if childbirth could be postponed until the too young mother was old enough and averted in mothers. Mother was old enough and which is being affected in mothers too old or too ill. The impact of both maternal and infant mortality will be significant. Factors that will greatly reduce maternal mortality rates and infant mortality rates in the safe age group 20 to 35 are better access to pre- and postnatal care, better access to contraceptive methods to permit child spacing, because by then they should have enough knowledge, by then they should have finished the schooling, by then they should have their home job doing, by then they should be able to take care of themselves. Both the husband too will be in support of the wife, and they should be able to have enough resources to cater for their family. Then another factor is the improved nutrition. Good health will be available, accessible, and they will be able to eat what they want and get what they want. Better trained village midwives too is one of the factors. At least they need to be, the village midwives need to be trained. Is one of the integration of maternal and child health services too. Improve childbirth and delivery conditions as a result of good the provision of modern equipment. In the olden days, we use fetoscope. We are still using it, but it's Doppler that is mostly used now. So this modern equipment is very, very important, and they are useful, and they bring the successful delivery. Better access to specialists for management of complications from labor and births, especially those who know about it, those who have trained, the midwives, the family planning planners, the doctors, the nurses. Because of this specialty, because of the knowledge they have in their specialty, in their field, in their profession, this affects most of the complications from labor and births. Better facilities for managing complications, like the tertiary institutions, the teaching hospitals, the specialist hospitals. This helps too to affect most of the complications from childbirth. Birth number, which are too many. Study shows that more children that a woman bears, that is the number of children a woman have, most of the women have a greater risk of dying as a result of pregnancy or childbirth. The number of children they have, the times of birth, also is one of the risks, or as a factor of dying of, or as is one of the greater risk of death too. Women who have had 5 or more deliveries are more likely to experience problems during pregnancy and labor, which requires cesarean section, which is more often not readily available or not performed early enough. As I've said, too many women who have 5 or more deliveries are more likely to experience all these complications, though they are not the one, because there are some other primates too that resulted into cesarean section. But there are some factors that brought this. But the women that have 5 or more deliveries are at risk because of the stretch of the vaginal wall, because of the stretch of the uterus. So, and in most cases, where the services are being taken, is either they are not readily available or the surgeries are not being performed earlier enough. This also brings another complications. The group has a significantly higher risk of miscarriages and prenatal mortalities than women undergoing their second or third delivery. As I've earlier said, they have the higher risk of miscarriages after the 5 or more deliveries than someone or most of the women that just had their third or second or third delivery. Birth interval of too close. Studies have constantly shown a strong or direct relationship between birth intervals and infant-child mortality rates. Babies born less than 2 years after the previous baby are twice as likely to die as babies spaced by at least a 2-year interval. In this, the mother will have recovered or regained her health. She'll have eaten well. She'll have come back to, she'll have regained her health. The baby too will have been developed and grow well. Then the baby is born less than 2 years because the mother has not fully recovered and she's even carrying another child, which may likely to cause a complications for her. The child who has been displaced by the baby is also at increased risk on average, about 1.5 times as likely to die if the newborn baby is within 2 years of his or her birth because of early weaning and is accompanied with the risk of diarrhea diseases and malnutrition. Yes, the child who has not gone to 2 years of age because of the early weaning of the newborn baby, this child may have a lot of risk of diseases. The risk of malnutrition, the risk of diarrhea, the risk of marasmus, the risk of kwashiorkor, all this risk may likely to come into place. Pregnancy and childbirth mortality risk versus contraceptive use. There is widespread information about the safety of some family planning methods, particularly with regards to combined oral contraceptives. There are also a misinformation about the safety of some family planning methods, particularly with regards to this combined oral contraceptives. Although both legal abortion and modern contraceptive methods involve some health risk, these risks are significantly lower when compared with risk from pregnancy and childbirth. The greater risk of death in using contraceptives comes not from the contraceptive itself, but from occasional method failure or incorrect method use, which then may result in a dangerous pregnancy. When the method used, when the client did not use the correct method, or the method used when it failed, which may result in dangerous pregnancy. And this one may likely to bring a complications, which may likely to affect the mother and the child. For example, condoms are in no way harmful. However, if a condom breaks during the use or is improperly used, the woman may get an STD, which is sexually transmitted diseases, or HIV, human immunodeficiency virus infection, or become pregnant and is then at increased risk of dying as a result of a pregnancy or as a result of sexually transmitted infection or as a result of AIDS, HIV/AIDS. So the proper method to be used is very, very much important. And the healthcare provider or the family care provider needs to explain comprehensively to the clients. And the client too needs to respond on the method choosing, demonstrating it and explain how it will be used so that there won't be any mistake that will bring a greater risk. In summary, family planning saves lives by enabling women to avert unwanted pregnancies and space unwanted pregnancies as well, and space the children as well. The risk of dying from childbirth is far greater than the risk of dying from contraceptive use. Family planning has contraceptives and non-contraceptives health benefits. And I saw something about the principle of family planning, which are the volunteerism, the informed choice, the widest range of family planning methods, which are possible, the integration within a general maternal and child health service program. Thanks for listening.